You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, smile makeovers using these new clear adult orthodontics with us, and it's called 6 Month Smiles. With us, we have an expert on the topic, Dr. McDavid. Dr. McDavid, welcome to the program.
I appreciate you having me, Randy.
Now, before we get into today's topic, for people that don't know your practice, who's your typical patient, and what are the different procedures you do?
Well, we have a general dentistry practice. There's 4 doctors in the practice. Dr. Baker, who established the practice over 30 years ago.
He's coming on the show after you, by the way.
Yeah. He's, like I said, he established it 30 years ago. Dr. Brown, he's got close to 30 years of experience in the dental field. He's been in our office for 12 years. Myself, I've been there for the last 4 years and was in a position, fortunate enough to be able to buy in this year. So
okay.
Dr. Baker and I are now officially partners. And last but certainly not least, my wife.
So your wife's a dentist too?
Yeah, absolutely.
Now you two were high school sweethearts.
Yep.
Is that true?
Yeah, that's right. That's right.
Did you know you were going to be dentists even back then in high school?
Not 100% sure. I was always interested in the medical field.
Okay.
I really figured it out and narrowed it down in college.
Now we've talked, I mean, you believe that you are changing people's lives by just changing their smile, okay? How important is the smile? I mean, you're a dentist, so you probably think it's pretty important. Well,
yeah, I might be a little bit biased coming from that standpoint, but the smile is not just important, Randy.
Okay.
I believe it's everything. Okay, it's the first impression. Okay, every time. Even the Academy of Periodontology did a study about the smile, and they found that 80% of Americans, the first thing they see when they, the first thing they notice about somebody is the smile. You might be thinking the eyes, maybe a cool haircut or something. It's a smile. Okay. So I think that kind of sets it up and just explains a little bit how important that smile actually is. Now, a funny story, Bill Dorfman told once. Who's your favorite supermodel, Randy? You got a favorite?
Well, I guess they're all my favorite.
You pick any number,
okay.
Any number or any one of them. But he said, take that supermodel, remove one of her front teeth. Is she still a supermodel?
No.
And she still has the beautiful body, hair, everything, the whole package. If they don't have the smile, they're not going to be a supermodel anymore. So I think that's another little story.
Good point.
There.
Very interesting. We're close to LA here in this studio here in California and San Diego, and they say when you go to LA and you want to be an actor, before even acting lessons, the agent will say, "Fix your smile." So you have seen in your own practice where you just straighten or whiten their teeth, and they act differently.
Absolutely, Randy. And it starts the day we take those braces off, okay? And we haven't altered anything. We haven't whitened yet. We haven't done any bonding, simply a little bit of contouring. We've straightened the smile, and instantaneously, they're a new person. They're more confident. They're smiling more. Each time they come back to the office for either a procedure or a cleaning, they're grinning ear to ear. And that's really, the joy we get out of doing this for people is we see those transformations. They look younger. We encourage everyone. We throw in free whitening, so we encourage everyone to do that, brighten up the smile. Again, brighter teeth are more youthful. They're straighter. They're going to be healthier, Randy. That's the one big point I'd really like to talk about that a little bit, because everyone just thinks it's a cosmetic thing. Oh, you're straightening the teeth. Yeah, they're going to have a pretty smile. But yes, they're actually healthier because they're going to be easier to clean. And
okay.
There's been numerous studies on this, but the Journal of the American Dental Association did one, and they found, obviously it's easier to clean. They're not crowded, okay? You don't get that plaque buildup, okay, which means healthier gums. You get that, it's easier for the hygienist to clean, around the gum line as well. So, that leads to a lot of health benefits, healthier heart. There's lots of studies out there about, bacteria under the gums getting in the bloodstream, causing plaque buildup in the major cardiovascular vessels. So
okay.
That's a big, big benefit that I don't think a lot of people necessarily realize, but again, very important.
Okay, so we're talking about 6 Month Smiles today. Adult orthodontics, I guess, is a hot topic these days. Yeah. But you say these are clear. They don't look like traditional orthodontics.
No.
Is that right?
Yeah, actually the brackets themselves are clear, okay? And then the wire itself is what they call camouflaged. It's white or tooth colored, and all the ties, everything involved is all either tooth colored or clear. So they're darn near invisible. From me to you, if you had them on, I would barely be able, now I'm a dentist, I'd say, oh, you had 6 Month Smiles, but somebody else might not even be able to tell you have them on.
How is it different from traditional orthodontics? Because I know you're a fan of traditional orthodontics.
Sure. Yeah.
But how is this different?
And Randy, there's still a place for traditional orthodontics. This isn't something that's going to replace that. Okay. It's not. It's not for everybody. Okay. If there's a severe malocclusion where the bite's way off, we're not getting into that. There's still plenty of cases that we're unable to treat, and we want to send to the orthodontist.
Okay.
But this is mainly a system for straightening the smile teeth. Okay.
So just the ones that show. You're moving just the ones that show.
Yeah, and that's how we tell people it's an average of 6 months treatment time. That's one of the main differences, though, between 6 month smiles and traditional ortho is certainly the time. Okay, average is about 6 months. Traditional ortho, you're 2 to 3 years time frame, and that's mainly like we said, removing the smile teeth. Okay, we're not getting into the complicated movements of torquing roots, molars, changing that bite. All that much. So
what are the age ranges of people getting this adult orthodontics? Is it more of the younger 30 plus crowd?
Yeah, it really, it's all over.
Okay.
It's mainly an adult system, but we've seen a few late teens that have their adult dentition fully erupted, and but we've seen people upwards of 50, 60. My oldest patient is 68 years old.
68 getting orthodontics, really?
Yeah. We just took her braces off a few weeks ago. Even Ralph Dolphy down in Florida, I think he's in the Sarasota area. He's doing, all his patients are 60s and 70s. So
getting adult orthodontics, is that
absolutely,
right?
Randy.
So it doesn't matter age. You can move teeth, and it's not dangerous.
Nope. Nope.
Interesting. So why would a 68-year-old though, or 70s, want to get adult orthodontics?
Well, basically, they've lived their whole lives with this smile that they're more or less unhappy with.
Okay.
And they figure now's the time, let's fix it. And with 6 month smiles, we can absolutely do that. And in a quick amount of time.
Would you like to see more of that older patient?
I mean, absolutely.
Because they don't know their options, maybe, that this can be done?
That's probably the main point here. They don't know that something like this is out there and available to them. But I don't think there's any age limit on happiness. And
okay,
I think that's where some of these older patients are coming from that vantage point.
Now you do Invisalign too, is that right?
Yeah, we do.
How is this? Because I think you told me on the phone you like this better than Invisalign.
Oh,
why?
without a doubt.
Why?
Well, with 6 month smiles, it's more like traditional ortho with the brackets and wires. So we have a lot more capabilities in the type of movements that we're able to achieve. So we can do a little more, some more severe cases, a little more complex cases versus the limitations of the active aligners like Invisalign or Clear Correct. They have to wear the aligners 22 hours on average, 22 hours a day. They have to take them in and out to eat with. With the 6 month smiles,
That's a good point. Okay.
They're in there, and
so
and
it's
you're
much
done with
faster.
It. You don't have to,
so 6 month smiles just much faster.
Oh, absolutely.
And you say some people are like done in 2 months, 3 months.
Yeah, some cases, and it depends. It all depends on the type of crowding, the severity there. If it's something real minor, yeah, we've had cases. In fact, I did them on my business partner, Dr. Baker. We did him on his lowers. He was done. He was ready to get them off in 2 because they were straightened up. I was like, let's give it another month or two,
so in
just
2
to
months,
make sure it's nice and perfect. Yeah, it's really fast.
And you talked him out of taking them off faster.
Yeah, he was done in 2 months. He's like, they're level. We're good. I like them. Let's get them off. I was like, give me a couple months, please.
And why is it so? As adults, it happened to me too. I mean, your lower teeth seem to get crooked. Is that common?
Well, a lot of people who have had orthodontics prior, when they're teenagers in their 20s, they either lose their retainers, they pop off, they don't go back to the orthodontist to get a new retainer, and then they shift. And that's where a lot of our patients come from, are those relapse patients that either didn't wear their retainers religiously like they should, or their retainer broke, or they lost it, and now their teeth shift. And
when you're older, your bottom teeth, it seems like that's all it shows. I watch my shows sometimes, and I can only see my bottom teeth.
Well, Randy, as you're younger, and you smile, more your upper teeth show. And as you age, the collagen changes, your lip structure changes, and when you smile, more of those lower teeth tend to show. So that's a pretty critical thing for adults. When we can straighten them up, it can make an immense difference on your smile.
So it's fast. Okay, so you brought some photos.
Yeah.
What are we going to look at here?
Okay. First patient here is Whitney.
All right.
She's 27 years old, and her main motivation coming in, she wanted to fix her smile because she was getting married. So let's take a look at her smile shot here, Randy.
Okay.
And look at the lower right side. It almost looks like she's missing a tooth. And that's just how crowded she is. That tooth is blocked out. When she smiles, you can barely even see it. Okay, even look at the retracted view, you know, how severe that crowding is on that lower right side. So she's thinking wedding time. I've heard about this 6-month smiles thing. I'm going to check it out. And we got her all fixed up, and she's beside herself. She had a beautiful wedding day. She brought us pictures.
Is that right?
Yeah, absolutely. And
very nice.
There's a photo of her. That's actually at one of our theme days. I believe it's an ice cream social. So she's enjoying. I think that's an ice cream sandwich there.
So when they come in, do they tell you that they don't like their smile? Do they say, "I hate my smile," or what? What do some of the people say?
I mean, that's the typical. You know, the typical patient comes in and says, "I don't like my smile," or there's crowding. I'd like to get my teeth straightened.
Now you also have training, I guess, a certificate to do sedation dentistry. Do any of these people get that done?
Now we haven't had to do any yet, but that's certainly something that's available, because there's probably people out there that want to get their teeth fixed that are simply afraid to come in. Okay, and kind of a funny story. Do you mind if I tell a quick story about my mother?
Go ahead.
So anyway, she's a high dental phobe, you know, high dental fear patient, and I was trying to get her to come in. She's had this tooth that, you know, had a big buildup done a long time ago, and it's barely holding on. The pin's starting to wear through, and she's like, "No, I have this sharp tooth, you know, this sharp area on my tooth." And I was like, "Mom, you need to get that crown on there. Okay, come in, we'll get the crown done." Well, anyways, you know, the tooth broke a little bit, so that was all right. She's got to come in now, right? Okay. Got it done. Everything went great. We sedated her, perfect. And she says, you know, and I was talking to her a few days before we came out here, and I was like, "Mom, you know, it took you 3 years to come in to see me. You know, what's going on with that?" And she's like, "Well, I came to your office to visit a couple of times." I'm like, "Oh yeah, that makes me feel real good, Mom. I appreciate that." But in her unbiased opinion, she did say it was her best dental appointment she's ever had. So
because of the sedation.
Oh, absolutely.
And you use that nitrous gas to relax people.
Yeah, we use that in combination, even when we're using our oral conscious sedation medication. Okay. We use a little bit of nitrous oxide as well. So.
All right, great. Okay, so you have more photos here.
Well, here's a patient, Randy. She's a college student. She goes to OU, and you can see there, you know, from the pictures, she has a pretty severe open bite in the front there.
What does that mean, open bite?
Well, the two lateral incisors, they're kind of flared out, and they're not in contact with anything.
So she can't close her mouth?
I mean, you can see in her smile there, you can see 2 big black holes right through there. Okay, so when we told her about the 6-month smile, she was super excited to know there was something fast we could do for her. She didn't want to do any type of veneers or anything like that, so we didn't have to prep. You know, that's the other great thing about 6-month smiles, minimally invasive. We don't have to prep the teeth at all. We're not removing, you know, really any tooth structure. So she was happy about that, and you can see from her results there, you know, beautiful smile. She's a young girl. She's getting ready to graduate.
That's a nice smile.
Yeah, I mean, we just took her braces off, you know, around finals time, so she's getting ready to graduate, and you know, with that pretty smile now, she'll be.
When it's all done, they're pretty excited. Like when they look in the mirror, do they ever get like emotional about it?
Oh yeah, maybe my first 5 cases, Mindy. You know, and to me, it wasn't an overwhelming change, but I mean, that's the key. When we took her braces off, she looked in the mirror, and by the way, she was getting ready for her daughter's wedding, so big event there. She started to cry. I'm not making this up. She literally had tears running down her face, because to her, she had just a little bit, you know, one of those canines that's sticking out just a little bit farther. We moved that in, didn't take hardly any time at all, and to her that was it. It was perfect. So she gave me a big old hug. And like I said, that was, you know, this was, you know, probably 3 years ago. It was one of, you know, like I said, one of my first 5 cases. So that, you know, that to me.
So back then, did you even get a little choked up there?
It was, yeah, it was great. It was wonderful.
So, are there a lot of people getting veneers? Because I guess, you know, they call it things like instant orthodontics, because you offer veneers where you are.
Yeah, sure.
So you can either get that instant orthodontics, which is a lot more money, right? Like more than 3 times as much as this.
It's a little more expensive, certainly.
You recommend this. So your ideal case is people just with crooked teeth that want them straighter.
Yeah. Well, I mean, certainly with the ortho, we can move the teeth, straighten them up, get them in the ideal position. Then if they have some wear, okay, we can definitely do some bonding, a little bit of contouring, okay. We usually do some, you know, form of
So a combination of therapies.
Absolutely, yeah. Sometimes the teeth aren't the ideal shape, so then we can go back and certainly put some veneers on there to kind of take it that next step. So
nice.
Most people, after we're done, take the braces off and we get them nice and straight, do that minimal contouring, they're done, they're happy. So, I mean, most of these people have lived with crooked teeth their whole lives.
You know, one thing I like about you is that, you know, on the phone you say that a smile can even make you more successful. You believe that?
Oh, without a doubt. Take, for instance, a set of twins, okay? They look the exact same, and they're on a job interview, okay? The employer's sitting there grilling them with all sorts of difficult questions, and, you know, one of the twins is constantly smiling and really, you know, he has a lot of confidence, you know, a lot of great answers, and the other one isn't, he's not smiling. It might be because, you know, he might not be real happy with his smile, so he just, and, you know, which twin do you think would get the job?
Well, that's a good point.
Okay.
You hire the one that looks the most positive, I guess.
Right, because that employer is sitting there, well, this guy's smiling, he's confident, you know, he's charismatic, you know, he's got a lot of high self-esteem, and the other one, you know, they're probably going to get some negativity from that, okay? So,
interesting.
In fact, Randy, if you don't mind, I brought a picture of the boys here.
Well, you showed me this in the green room. I said,
yeah.
I said, I wish we could fit this in on the show.
And that's why that story really kind of hit
Let's
home.
shoot to this for a second.
Boys.
And those are your sons.
Yeah, they're 5 years old. That's actually our newest newborn there. That's
it's like wrapped in some sort of a little
yeah, that's her little
fancy
Cleopatra
blanket
shot.
Yeah. Cleopatra.
Yeah. Yeah. So.
Are they going to be dentists? You think either one of these boys?
That would be fine by me. Yeah.
Any
absolutely.
dentists in your family?
I'm first generation.
Is that right?
Yeah.
Well, good.
Yeah.
Well, good. Okay, so you know, the question really was though that that a smile could really help you in business, I guess. Mm-hmm. You know, if you're smiling, you appear to be more positive and more presentable and things like that. And you've seen that in your own practice, where you change their smile.
Oh yeah. Yeah. Take a look at Arlene here. She has lived her whole life, and she has not liked her smile. Okay, she's in her late 60s.
All right.
Okay, and she decided now is the time. I want to get something done about this.
Now, does she come in your office knowing already about this adult orthodontics or 6-month smile, or she just says, "What can I do?"
Yeah, she came in. I believe she saw the newspaper ad that we have. Okay, and then we certainly gave her a little more information about it, and she thought that sounded great. So during her consultation, you can notice she's really crowded in her upper arch, little narrowing there. She's kind of end to end on the canines, severe crowding, okay, severe crowding on the lower. So, interesting point about this case, we actually did an extraction on her.
Okay.
Okay. We don't do it a lot, okay, we try to avoid it if we can, but there's simply no way to straighten her lower arch without doing so. We actually took out one of her lower incisors.
Okay.
And the way we do it, though, is with some new technology called physics forceps, okay? So it's not this, you know, back and forth, you know, this super traumatic experience. It's a forcep we use that uses really light forces, and we barely do anything else. Yeah, it's a matter of just a little wrist movement. It pops out like a bottle opener. They're amazing. I was a skeptic when, you know, we first heard about them. We got some, we tried them out. They're really, really cool. So
this after is very nice. So this is the 6-month smile, these clear braces.
That's right. And her case was a little bit longer, you know, just due to the amount of the crowding. Okay, she was about 7 months' time. But as you can see there, beautiful smile. You can see it in her, you know, her headshot there. She's totally excited about her brand new smile, her straight teeth. Because like I said, she's in her late 60s. She's lived her whole life.
And she didn't like her smile for a long time?
She hated it. She hated it. She didn't like to smile.
When it's all done, do they say I should have done this years ago?
She really wishes, and we hear it all the time. You know, I can't believe I didn't do this earlier, or I didn't know about this earlier. So.
But people don't like going to the dentist, right?
Oh, they hate the dentist.
Do you ever hear it?
Every day.
What do they say? How do they say it?
They come right out and say, you know, I hate the dentist.
Like, no offense, do they say?
Sometimes they'll be nice enough to say that, but others they just come out.
Do you have a comeback for that?
What do you say to that?
You can just
there
kind of
really is no
laugh,
comeback.
or...
You just kind of, you know, brush it off.
But when it's all over, they end up liking the dentist?
Absolutely, yeah. And that's one thing about our office we strive for is, you know, patient comfort, you know, for sure. I mean, it's kind of cliche. You know, everyone says, oh, comfortable, you know, experience for the patient, but we really do strive for that. And sedation, you know, plays a big role in that.
Okay, good. So you have more photos, and we're just about out of time. So what else are we looking at here?
Let's take a look at Ashley here. Younger girl, she's 19, okay?
Wow.
After high school, she's planning on moving to New York to become an actress, okay? She knew herself that she's not going to be able to pursue that career having a smile like that.
Is that common, you know, a tooth that high?
Yeah, it is. We see it all the time. And the reason you might not see someone, you know, out on the street or something like that is because they don't smile. So you don't see something like that. In our office, we see it all the time. So we had a couple different options for Ashley. She wasn't really too thrilled, honestly, about the braces and all that. She wanted to do the Invisalign. We kind of steered her away from that just due to the severity, you know, of the crowding there. So she went for the braces. And if you take a look there,
very
after
nice
shots, beautiful smile, vibrant. You know, she lightened her teeth a little bit. There was one thing we did notice. On the lateral incisor on her upper left side there, the gum was a little bit puffy, okay, and a little bit flat, didn't have much architecture. So we fixed that real simply with our soft tissue laser, gave that gum then a nice positive architecture there to really kind of finish off her smile.
You know, that's a big difference. I mean, when we look at the before and after smile, I mean, it's a very feminine smile as well. I'm not trying to side with you here, by the way. People need to know this is a real interview, but this is very nice. And you say it can be done very quickly, and these are clear braces.
They're darn near invisible. Yeah, absolutely.
Okay, good. So you have a few more. We have only time for a couple more.
Okay, this is probably the best case that we've done.
You saved the best for last?
If I had to rank them, this is kind of, I keep this in a special place.
All right. Whoa.
This is Christina, okay? And she, again, late 20s. You know, she's coming to us, and she, again, is a patient, doesn't like to smile. You can barely see any other teeth when she smiles there. Okay, you see her two front teeth, and that's about it.
All right.
Okay, and the problem is she has, the canines are a little bit impacted. Okay, she actually has retained baby canines still in that first shot there. So with her, what we did, we brought the canines down into the arch. Okay, straightened everything up, and you can see there in the after shot, Randy.
Wow.
Now look at the before and then look at the after.
Okay.
You really see it in her eyes. Okay, she's like a brand new person.
Yeah.
Okay, the before shot, she doesn't even want to smile. We were struggling to get her to give us some sort of smile. Okay, and in the after, you don't even ask her. She's smiling when she walks through the door. So brand new person. You know, she just had a little baby girl, 4 years old, Aubrey. She was in not too long ago, beautiful. And funny story with her though, is her bosses, when we first started the idea about doing the braces, they were totally against it. You know, she works for a bank, talks to people all day long. So they're like, you can't have braces on for 6 months. No. And honestly, she was a little bit longer. She's about a year's time. Okay. Okay. But now they're like, oh, Christina, you know, we love your smile, beautiful, great, and you know, we kind of stuck it to the man there. So that's our little inside joke, me and Christina. So.
So final message, and we're just about out of time. So, you know, we're talking about adult orthodontics today. You know, 20s, 30s, 70s. You say you have a friend that almost specializes in the 70-plus crowd with this 6-month smile program. So take us through the process. Somebody watching this, they don't like their smile, right? They come in. What's the process like?
Basically, we'll do a quick consultation. We'll talk to you a little bit. You know, we need to know your concerns. What do you want to have corrected? Okay, because you kind of look at this as chief complaint orthodontics. Okay, my canine's out, my teeth are crowded, whatever it may be. Tell us that, we'll fix it, and you'll be extremely happy with your smile or the results when we're all done.
Now we are out of time, but I know you wanted to show me the brochure from the company.
Yeah, this is the 6-month Smiles brochure. They have a couple of nice examples of before and after shots, and on the back there too, they have an example of someone who actually has the braces on. And if you look there, you can barely even see them. Like I said,
so
from me to you,
if
if you had them on, I'm a dentist again, I would see those and know it. But you know, common people would barely even be able to see them.
So it's about the same price or a little bit less than Invisalign?
It's a little more affordable than Invisalign.
Okay,
yeah.
And it's faster. You could
It's
do
much
more things
faster,
with it.
Much faster.
And
2 to 3 times faster.
And you do Invisalign.
We do.
I mean, you're
yeah.
not putting
and
it down.
There's a definite place for Invisalign, but we have so much more control with the brackets and wires. I try to steer people towards that, unless they're totally against bonding to their teeth or something like that. We try to get them into the 6-month smiles. I think it's just a better product. Flip over the brochure now,
okay,
Randy, and take a look at that middle before and after there with the young guy there. You see he has a ball cap on when he came in. He seems almost like just a punk kid. Yeah. In the after shot,
looks like a male model.
You could be a big-time CEO of a company or something like that. Just an entirely different person. And then with the gal there, the same thing. You see it in her eyes, just an entirely different person altogether.
You know, we spoke on the phone. You said that, and I always feel like you're exaggerating, right? Different people are exaggerating, but you say a smile can really enhance the appearance. And you're right. It's obvious.
It not only enhances the appearance, Randy, but I think it enhances who that person really is, okay? Not only do you look better, but you're absolutely going to feel better about yourself. Now you're not holding back your smile. You're walking around, you're smiling everywhere. You might be sitting there, you're going to smile and not even be thinking about it. So it's not just the appearance, but you feel a lot better about yourself.
Okay, good. I want to thank you for coming on the show. Great stuff. They could go to your website if somebody wants to make an appointment to see you or one of your associates.
Yeah, they can visit friendlydental.com. There's more than enough information on the website about any procedure that we do.
All right. I want to thank you for coming on the show.
I appreciate it. Thank
Great
you very
info.
much.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, visit our website at wellnesshour.com and just put in Dr. McDavid. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.